San Francisco General Hospital's monkeypox vaccine clinic is closed today because it ran out of vaccines. It reopened last week after getting more doses, but many people we've spoken with say they waited for hours to get the shot, and some say despite waiting a long time, they weren't even able to get vaccinated because the clinic only administers a certain amount of vaccines each day, and they run out. SF General gave out 550 doses yesterday. San Francisco's Department of Health says it requested 35,000 doses from the federal government, but have only received 7,800. They are not sure when they will get their next shipment. As the Department of Public Health waits for that new shipment, state health officials confirmed that more than 10,000 doses have been sitting and waiting for 5 days now. Our Rob Nesbitt spoke with the CEO of the San Francisco AIDS Foundation and Supervisor Rafael Mandelman about the delay. Rob joins us now live in the studio with more on what they're saying. Good evening, Rob.
Grant, for the last 2 weeks, most of the pressure has been put on the federal government to get more monkeypox vaccines out to the states. Questions are now being asked about why California doesn't have a more streamlined vaccine process. 6,500. That's how many people are currently on the monkeypox vaccine wait list at the Magnet Sexual Health Clinic in San Francisco. CEO of the San Francisco AIDS Foundation, Dr. Tyler Tremere, says time is of the essence to stop the spread.
Every day that we go without getting vaccination into the arms of individuals who are at high risk for monkeypox is another day where the spread of infection continues to grow in our community.
The California Department of Public Health confirmed to KRON 4 that they received a new shipment of Jynneos vaccines Thursday, 10,299 doses that have yet to be distributed to county health departments begging for more.
That the urgency around what's happening in a community of cis and transgender men and non-binary folks who have the same social and sexual networks is not a priority for them.
Dr. Tremere says Magnet has around 300 shots left, and Zuckerberg San Francisco General Hospital ran out of their vaccine supply Monday. Supervisor Rafael Mandelman was frustrated to hear about a delay at the state level, but he puts the majority of blame on the federal government.
Well, the biggest thing is that the feds need to do more. They need to be more urgent. They need to acquire more vaccines, and they need to get them out much faster.
The U.S. is considering declaring monkeypox a health emergency after the World Health Organization declared it a global health emergency over the weekend. The virus may not be life-threatening, but something to be avoided as more patients come forward and share the seriousness of their symptoms.
Painful and potentially disfiguring, and can take you away from all the important things you have to do for weeks and weeks, much longer than a COVID quarantine.
If the U.S. does declare a health emergency with monkeypox, there could be more funding for treatment. Experts are also calling on the White House to appoint a monkeypox coordinator, one person making decisions instead of several organizations deciding next steps. Reporting live in studio, I'm Rob Nesbitt, KRON 4 News.